Everyone knows about the problems of the Irish healthcare system. We hear about them every day. But at Health Innovation Hub Ireland, working with Spark Ignite, we're looking for solutions. More specifically, we're asking our staff for solutions. They can see a problem, they're working with it, they've thought of an idea that'll solve that problem. What we're doing is offering them an avenue, a vehicle, a method of getting their idea assessed, tested, and bringing that through to something that actually works within the healthcare system. In the video that follows, you're going to see some great examples of solutions to problems. Let's just ask our staff.
Marie Ronan and Rose Cafferkey, both pharmacists, proposed a simple digital solution to tackle antimicrobial resistance. In Mayo University Hospital alone, over 2 years, their system demonstrated a €100,000 decrease in spending on antibiotics, a 93% decrease in the use of most broad-spectrum antibiotics, a 45% decrease in the use of IV antibiotics.
We have developed the SMART tool because research tells us that 1 in 3 patients admitted to hospital are prescribed antimicrobials, and up to 50% of these antimicrobials are prescribed inappropriately. This leads to antimicrobial resistance, or AMR. Our SMART tool is an audit system that provides analysis and feedback in real time. This surveillance of antimicrobials can identify problem areas where quality improvement initiatives can be implemented to improve antimicrobial prescribing and use. An added benefit of our tool is that it allows for the automatic generation of key performance measurement parameters that have been set by AMREC.
Helena Begley, Alison Harper and Fergus Guilfoyle implemented a blood stock management system between 3 different hospitals to reduce costs and improve blood availability in the region, saving €30,000 in 2019, a reduction in the waste of blood and an increase in the appropriate use of O-negative blood by 20%.
We decided to begin a weekly blood exchange programme. Blood with 2 weeks to expiry is sent from Naas Hospital and the Coombe Hospital to Tala Hospital and exchanged for units with 3 to 4 weeks left until expiry using First Direct medical vans. We decided to exchange all blood groups, not just O-negative. We have now started to exchange products other than red cells, for example plasma.
Norma Caples, an advanced nurse practitioner, created a patient engagement app for early identification of heart failure associated with sudden weight gain. There are potential savings of €15,000 per patient per year for the 90,000 people diagnosed with heart failure in Ireland.
The patient enters their weight daily into the app. If the weight is increased by 2 kgs or by 4 pounds, the patient receives an alert. This alert advises them to contact a healthcare provider. This will create early intervention, which increases and improve patient outcomes and also reduces the risk for admission to hospital.
Siobhan Corcoran, a senior physiotherapist, designed and implemented a community-based solution to assess osteoarthritis knee patients. Her system has reduced the waiting times in Waterford University Hospital from 4 years to under 4 months, with patients now receiving the right care at the right time.
The pathway represents a fully integrated and unbroken pathway of care for knee osteoarthritis. It is patient-centred with care provided locally and ensures continuity of care for chronic MSK conditions. As part of the pathway, a rapid access knee clinic in UHW can provide up to 5 times quicker access to care than the current model. The pathway is also scalable both regionally and nationally and reproducible for other chronic MSK conditions. Results from our pilot sites have been hugely promising.